In this video, we'll take a closer look at key indicators from Section 5 of the RACGP Standards for General Practice. This section has 3 standards, including facilities and access, equipment for comprehensive care, and clinical support processes. Practice nurses often play a big role in supporting standards from this section. Remember, some of the indicators have a triangle, which represents that they're required, and those without a triangle means that they're recommended but not essential in order to become accredited. The key criterion and indicators with a special mention as part of this section include Criterion 5.1.1, Practice Facilities. Now, your practice must have at least one dedicated consulting room for every member of the clinical team working in a practice at any time. Consultation rooms should have adequate lighting, an examination bed, and they must ensure patient privacy by use of adequate curtains or screens, as well as gowns and sheets. The practice must also have one or more height-adjustable beds. Criterion 5.1.3, Physical Access. The practice should have wheelchair access, or if physical access is limited, then you must provide home or other visits to patients with disabilities or special needs. Criterion 5.2.1, Practice Equipment. There is a comprehensive list of all required equipment as part of the standards. You must also demonstrate timely access to spirometer and ECG machine, and show how you maintain equipment according to a documented schedule. Both accrediting bodies provide templates for this. It's called a schedule of maintenance. Criterion 5.2.2, Doctor's Bag. There's actually a comprehensive list of all the equipment that is required as part of the standards. Criterion 5.3.1, Safe and Quality Use of Medicines. This is another area that often catches practices off guard. Patient records must have accurate and current medicine lists, and all the medicines, including samples or any medical consumables, should be stored and handled in accordance with manufacturer's directions, but also should be within expiry date. Criterion 5.3.2, Vaccine Potency. There should be a person with the primary responsibility for cold chain management within the practice. This responsibility should also be included in their position description. You must also perform an audit of your vaccine fridge to ensure temperatures are within the recommended limits and that thermometers are providing accurate readings. The surveyors will request to see evidence of your daily monitoring of your vaccine temperatures, as well as perhaps a data logging over a period of 7 days. Criterion 5.3.3, Healthcare-associated infections. There should be a person with the primary responsibility for coordinating infection control processes. The team members with delegated responsibility for the sterilization process should also be able to describe in detail how sterile procedures are undertaken. If your practice uses only disposable instruments, then obviously this area becomes a lot easier to manage. All members of the practice team must be able to demonstrate how risk of potential cross-infection within the practice are managed. This could include procedures for hand hygiene, the use of personal protective equipment or PPE, triage of patients with potential communicable diseases, safe storage and disposal of clinical waste, including sharps, and managing blood and body fluid spills. Your staff must be able to describe the process for the routine cleaning of all areas of the practice, and there should also be documentation on the practice cleaning policy. And subject to the informed consent of individual practice team members, the immunization status of practice team members must be known and recorded, obviously in a confidential place, and staff should be offered recommended immunizations as appropriate to the types of activities and roles that they play in the practice. And finally, the practice team will need to explain how patients are educated in respiratory or coughing etiquette, hand hygiene, and precautionary techniques to prevent transmission of communicable diseases within the practice. This is most easily accomplished by the use of posters and brochures in the waiting room. And this concludes the Accreditation Support video series. We hope you have enjoyed this series, and remember, we also have a comprehensive accreditation resource guide on our website, semphn.org.au. Thank you for watching, and we hope you have a great accreditation. See you next time.